Hi, I am Dr. Mike Van Thielen. In this short video, we will share 5 facts about fibromyalgia. Fact number 1. Fibromyalgia is an invisible disorder, but is a real condition. Like other so-called invisible disorders, fibromyalgia poses a challenge beyond symptom management to those who are diagnosed with it: the struggle for credibility. Since fibromyalgia patients have no visible signs of the pain and symptoms they suffer from, other people often dismiss this condition. Even physicians often dismiss the patient's symptom descriptions, since there is, for instance, no blood test that can confirm whether the patient has fibromyalgia or not. Fortunately, a multitude of research results demonstrate clearly that fibromyalgia is real. For example, MRIs show significant differences in the brains of people with fibromyalgia compared to the brains of people who do not have fibromyalgia or a chronic pain disorder. Most physicians lack knowledge of this condition and simply misunderstand the origin of the pain and symptoms. When their prescription drug and recommended exercise regimen fails, they often proclaim it's all in the patient's head. Fact number 2. Conventional doctors often confuse the symptoms with the cause and vice versa. Anxiety, stress, and sleep disorders are not the cause, but can be aggravating factors of fibromyalgia. Fibromyalgia patients may suffer from a variety of symptoms. These specific symptoms include pain, tender points, headaches, fatigue, and weakness. The non-specific symptoms are not limited to sleep problems, brain fog or fibro fog, stress sensitivities, GI problems such as IBS, irritable bowel syndrome, etc. Often one symptom brings on or exacerbates another symptom, and the condition tends to worsen over time. While drugs or medications may diminish, not abolish, symptoms in 1 out of 4 patients, they often add additional symptoms, in other words, adverse reactions, and do not address the cause of the symptoms. We need to address the symptoms and the cause of fibromyalgia to be successful and reap the long-term benefits. Fact number 3. Fibromyalgia also affects men. According to the National Fibromyalgia Association, the NFA, between 75 and 90% of people diagnosed with fibromyalgia are women. Fibromyalgia affects over 10 million adults in the United States, which means that between 1 and 2.5 million men have been diagnosed with fibromyalgia in the United States. I predict this number is much higher due to the gender-based bias in how physicians diagnose fibromyalgia. In addition, men tend to be more stubborn when it comes to going to a doctor. Men were, not anymore, raised to believe that men don't cry. They are told to take it like a man and shake it off. At an early age, men are inundated with concepts like men fix things, men are the head of the household, men are hunters, etc. And therefore, showing pain is showing weakness. But unlike acute injuries and pain, fibromyalgia does not shake off and tends to worsen over time when not addressed properly. Fact number 4. Fibromyalgia is systemic. We already know that fibromyalgia pain is not local pain and that many symptoms are the result of toxemia, systemic inflammation, and free radical damage. Excess fibrogenesis and hormonal imbalances may also be causative factors as well as emotional factors. Therefore, fibromyalgia should not be treated on a local level, but rather systemically, or even better, holistically. Fact number 5. There is a solution. From a conventional medicine point of view, there is no solution indeed. Drugs may relieve some pain, improve sleep, or relieve some digestive problems in the short term. However, these drugs contribute to the toxic load in our body and cause more issues in the long term. Massage therapy, physical therapy, acupuncture, chiropractic care, meditation, yoga, etc. also may have short-term benefits and even long-term benefits when applied correctly for this specific condition, but they won't resolve the problem either. There exists no magic or silver bullets or elixirs or pills to correct the causative factors and regain balance in your body. Those practitioners that sell a supplement or a therapy as a solution for fibromyalgia are merely taking advantage of desperate people in pain. Getting your fibromyalgia into remission requires that you address toxemia, free radical damage, fibrogenesis, hormonal imbalances, functional imbalances, and systemic inflammation. To succeed, you need to take responsibility and participate in your own healing. We can blame our doctors and healthcare professionals. We can blame our government for the G5s, the EMFs, the GMOs, the fluoride in our water supply, etc. We can blame the false advertising and fake news, and we can blame our parents. But it's time we take responsibility for ourselves and our loved ones. You need to take control of your own health and participate in your own healing. I can coach you on how to put fibromyalgia into remission, but ultimately you have to do it. You need to have the willingness to make this change and acquire the knowledge and skills to succeed. For more information on fibromyalgia and an easy to implement action plan to put fibromyalgia into remission, please visit my website mikevanthielen.com.